Hi, this video is about gastroenteritis. I want to point out something before the video. The most important thing I mention here is oral rehydration therapy. That formula right there. Table sugar, salt, water. Simple. Make sure you get good oral rehydration therapy. The other thing is, if you develop rashes or something else that's totally abnormal from the context of a gut viral process, please come and see us. There are certain things that are difficult to diagnose. We need every clue we can get. Thank you. This video is helping you make some decisions about the gastroenteritis that you're having. Most gastroenteritis is difficult to diagnose unless it's part of an epidemic, meaning it could be viral, it can be bacterial, or it can be amoeba. If we do a few things, a few tests, we can generally quickly tell which it is. Viral gastroenteritis presents with diarrhea, vomiting, malaise, loss of appetite, and with or without fever, frequently from the norovirus or rotavirus. 90% of gastroenteritis is the Norwalk virus in adults, so this is usually seen in epidemics. Bacterial gastroenteritis is frequently bloody stools and diarrhea with a high fever. If the stool is bloody, this is suggested we need to get samples, generally, unless we know from an epidemic what's going around. Campylobacter is the most common. Clostridium difficile colitis is very important to recognize. If a person's been on several antibiotics or even one antibiotic and then develops a gastroenteritis, this may be a unique problem of Clostridium difficile. And we need to encourage you to have a dialogue with us. We don't want necessarily you to come in without some precautions because this is a very contagious problem. Enterotoxic E. coli is common traveler's diarrhea, and this can be diagnosed easily usually. Amoebic dysentery or amoebic gastroenteritis is due to Giardia in the United States, most often from contaminated water supply, particularly mountain streams. In the world scheme, Cryptosporidia is the most common. So most likely, number-wise, you have a viral gastroenteritis. You may have the full viral syndrome with a headache, fever, muscle cramps, and the viral prodrome for several days before it hits. If you have this, you should be lacking in a focal abdominal pain. This should be a diffuse abdominal pain pattern. In the event it localizes, go to one area, then we have other concerns. The upper right quadrant is where your liver is. The lower left quadrant is where your appendix is. The lower right side, you may be having some diverticulitis or something else. We need to see you if the pain localizes. The other major thing is if you cannot stay well hydrated, we need to see you. Hydration is critical. You hydrate by oral rehydration therapy. You can go online and look at this, or buy some electrolyte replenishing solution and make sure it's dilute enough to be able to manage this episode. You can allow the diarrhea temporarily for it to purge your system, then start over-the-counter medications to stop the diarrhea like Imodium, which is loperamide. We will probably send a stool sample if we don't think clearly this is a viral gastroenteritis as part of a epidemic. And we will hopefully manage to be able to assess your state of hydration. If you're well hydrated, we'll send you home with the plan to continue oral rehydration therapy. If it's bacterial, Campylobacter is suspected. It is the most common cause of bacterial gastroenteritis in developed countries. If you have had an antibiotic infection, it is and now a gastroenteritis is critical. We communicate about this. We may start you on antibiotics initially before we even see you, but with specific ones in mind. If the E. coli is traveler's diarrhea, we can understand this and manage it easily. But we need to check, because if it is a hemolytic uremic syndrome causing blood in your urinary tract system, you put you at risk for a number of things. So this can be understood by an analysis of the type of E. coli in your system. Mind you, E. coli is the normal inhabitant of the gut. It's just that certain members of this group can be pathogenic, cause disease process. This being said, the hemolytic uremic syndrome is rare in adults. Giardia and Cryptosporidia are the amoebas that result in this, and they're easily detected looking at the microscope at the stool sample. When we find out, we'll treat you with specific medications. These are specific antibiotics for both in that event. So, avoiding the side effects. One of the best things to do is adhere to oral rehydration therapy, take acetaminophen for fever. If you have comorbidities, we need to discuss these, particularly in diabetes. If your blood sugar is over 250, if you cannot stay well hydrated, we are headed for disaster. You probably need to be switched over to insulin for temporary management. If you are already on insulin, you may need hospitalization. Individuals that are immunocompromised have increased risk from any type of gastroenteritis, and this needs to be discussed. Kidney failure, lung disease, heart problems, all can be made worse, particularly if a person gets potassium depleted as part of the diarrhea of a gastroenteritis. Generally, there's a sense of great weakness after a gastroenteritis, usually due to electrolyte depletion, particularly your potassium in your gut. Of course, in electrolyte replenishment, sodium is the main electrolyte we focus on initially. In the event that you're having increased respiratory rate that seems abnormal, we have to consider this may be due to a change in your respiratory status. This demands looking at unless you can perceive it yourself. And as I said, if you can stay well hydrated, it is the main thing in all ways in your prevention of worsening the condition. Following this episode of gastroenteritis, it may be appropriate to reassess your diet and your constitutional base and get a physical exam if you've been missing one for a while. So, when in doubt, we'll order some labs and check your electrolyte balance, your liver function, your kidney function. We will also look at particular tests or analysis we can do of your white cell count to question whether there are parasites present. You may need IV fluids. If things get severe and you have diarrhea, we'll definitely want blood gases to ascertain how acidic your blood is. And if things don't go your way, the sooner you get to a hospital for good care, the better the outcome will be. As you recover from the gastroenteritis, you'll need to start out with starchy foods in general, those that do not have antigenic response. Stay away from protein-rich foods. Cook your protein-rich foods significantly at first to denature things. You don't want to create an allergic process in your gut now by eating too quickly. Make sure you maintain adequate caloric intake during this. These can be just starchy foods that are absorbed easily in your small intestine or almost even in your mouth. And as I said, you'll have to treat any tendency to vomit to avoid vomiting, as this can also create complications. I encourage you to communicate with us if there are any perceived complications. If we can't see you, if we're too busy, you may have to go to the emergency room.